Beetroot is an established digital health platform developed and supported by Therapy Audit Limited. Beetroot's evolved in three areas. 1. Providing digital patient monitoring for NHS secondary care customers. 2. Providing data collection and audit for public health customers. And 3. Leveraging customers' clinical data to find predictive patient monitoring algorithms and new models of care, working in collaboration with academia and major pharma. The first two areas have some long-standing customers. The third area is innovative and represents a significant future potential. Here's what some of our customers have to say about Beetroot.
I'm Emma Chaplin. I'm the Deputy Director of Nursing for Cancer, and I work across Mid and South Essex NHS Foundation Trust. So we cover three large hospitals. We are one of the largest trusts within the country now since we've merged, and we diagnose over 10,000 new cases of cancer each year. So we see a large number of people affected by cancer. And we reached out a number of years ago to Beetroot, to the company, to support us with remote monitoring of patients, so to ensure that they are followed up effectively and safely, and ensure that we give a good service to them. We wanted to improve our service, and we've been really fortunate working with Beetroot because they've enabled us to set up a really good remote monitoring system. And that means that it's really beneficial to patients, but also beneficial to our service and our clinicians. And the reason being is that it can mean that patients are not regularly having to come up to hospital if they don't need to. So it means that we can remotely monitor them. We can also send questionnaires to them, which has been really great service. So we can do quality of life assessment, holistic needs assessments. And that means that we can get information really speedily from patients, and also if their results, we can monitor them, and if there's a problem or a concern, that highlights to the nurse specialist, and it means that we can rapidly access the patient and contact them and bring them into clinic. So we're actually seeing them when we need to see them.
My name's Katie Lowe. I'm the Associate Director of Nursing at Mid and South Essex Hospitals. For us, it's the adaptability of Beetroot that is the thing that serves us really well. We know that we can use it in various different ways against different tumour groups. Obviously the tumour groups are very, very different. Patient cohort is very, very different. The disease progression is very different. Everything acts in a way that you can't really predict to be able to build a model that would move from one tumour site to the next. So the beauty of Beetroot is that we're able to kind of use it in a way that facilitates the services as best as possible, but it is also adaptable so that we can move away and think, actually, that's not quite the right way that we need to be looking at it. Our nurses lead that process with the clinicians, and so we can step back, look at the process, come to you guys, have a conversation and say, actually, we need to turn Beetroot in this direction for us to capture this cohort, for us to be able to bring about this effective change. And by doing that, it just means that everything is really bespoke, and that isn't just to the tumour site. We can really bespoke it to each individual patient, which with many digital services that we have in the NHS isn't something that is readily available. So that's why it's so unique and why we want to keep a hold of it and drive it into as many tumour sites as possible.